Hey everyone, and welcome back for another deep dive with us. Today, we're going to be tackling a real medical puzzle.
Oh, yeah.
The case of, an elderly man who's experiencing breathlessness.
Right.
But get this, he has a completely normal physical exam.
Wow.
So to help us kind of unpack this,
Yeah.
we're going to be looking at excerpts from a medical education document,
Okay.
really trying to figure out how doctors approach this kind of tricky situation, where
Yeah.
like the usual clues are missing.
Absolutely. And I think it's so interesting how
Right.
it really forces you to rely on taking like a very systematic approach
Yeah,
and to very carefully think through all the possibilities.
it's true. So imagine you're the doctor and you have this elderly man.
Okay.
In your office, he's clearly struggling to breathe.
Right.
But when you examine him, like everything seems totally normal.
Oh, that's interesting.
What would your first instinct be like? Where would you even begin?
Okay, so first thing I would do is I would like take a deep breath and resist that urge to just like jump to a conclusion, right? Because a normal physical exam
Yeah.
doesn't mean there's nothing wrong.
Yeah.
It just means we need to be like extra thorough in our investigation.
Okay, so patience is key.
Yeah.
But like, where do you even begin
Well,
when the usual signs aren't there to guide you?
you always start with the patient's story.
Okay.
Um, getting a very, very detailed history is absolutely crucial in these cases.
Okay.
Like, think of it like, you're building a foundation for your investigation.
Yeah.
You need to ask, very specific questions to understand, like, the nature of his breathlessness.
Okay.
Things like, when did it start? Was it sudden or was it gradual?
Okay.
How severe was it at the onset? Has
Yeah.
it been constant? Or does it come and go?
So you're trying to create a timeline of the breathlessness and
Yeah.
see how it evolved over time.
Exactly. But the questioning goes beyond just the symptoms themselves.
Okay.
We also need to delve into his past medical history.
Hmm.
Has he ever experienced anything like this before?
Okay.
Does he have any history of respiratory conditions like, asthma or
Yeah.
EOPD?
Right.
What medications is he taking?
Yeah.
Could any of those be contributing to his breathlessness?
You're looking for any potential connections or red flags
Yeah.
that could point you in the right direction.
Exactly. And we can't forget about like family history.
Oh, right. Yeah.
Are there any breathing problems that run in the family?
Okay.
And then we'd also ask about, his occupation and his lifestyle.
Hmm.
Has he been exposed to any environmental pollutants or irritants? Does he smoke?
Right.
All these factors can play a role.
It's a lot to consider.
It is.
So it sounds like you're gathering as much information as possible
Yeah,
to really paint a complete picture of the patient's health.
that's the goal. We want to leave no stone unturned.
Yeah.
And, even with a normal physical exam, we wouldn't stop there.
Okay.
Some basic tests are always necessary, just to rule out some of those more obvious causes
Yeah.
and to gather more information.
Okay, so what kind of test are we talking about here?
Well, we would start with a simple observation.
Okay.
Just checking for cyanosis,
Okay.
which is that kind of bluish discoloration of the skin that
Yeah.
can indicate low blood oxygen levels.
So even though like his lungs sound clear, his skin color could be a clue
Absolutely.
that something's amiss.
Exactly.
Interesting.
Then we would move on to some routine blood tests.
Okay.
Things like a full blood count to check for anemia, as well as tests to assess, kidney and liver function
Okay.
and thyroid hormone levels.
So these tests just help you get like a general sense of his overall health,
Exactly.
rule out any like obvious issues.
Precisely. And of course, a chest x-ray is essential
Right.
in any case of unexplained breathlessness.
Yeah.
It can reveal things like fluid in the lungs, pneumonia, or even tumors.
Mhm.
We'd also do an ECG to assess his heart's electrical activity and rule out any kind of cardiac causes for his breathlessness.
Now, I remember from the source material that the transfer factor is considered particularly important in these situations.
Right.
Can you explain what that is and why it matters?
Okay, so the transfer factor is a measure of how well oxygen
Okay.
is moving from the air sacs in the lungs into the bloodstream.
So it tells us how efficiently his lungs are delivering oxygen to his body.
Exactly. And it's especially important in cases of potential thromboembolic disease.
Thromboembolic disease. You mean blood clots?
Yes, blood clots in the lungs, also known as pulmonary embolisms,
Okay.
can block blood flow and severely impair oxygen transfer.
Okay, so that makes sense. So we have the patient's history.
Right.
We have some initial test results.
Yeah.
Are we starting to get a clearer picture
Mm.
of what might be going on?
We are definitely gathering pieces of the puzzle.
Okay.
Based on this information, we can start, narrowing down the possibilities
Yeah.
and exploring different diagnoses. And believe me, there are quite a few potential explanations for breathlessness,
Okay.
even when the physical exam is normal.
Oh, now you've got me hooked.
Yeah.
I'm dying to know what those potential diagnoses are.
Yeah.
But I guess we'll have to wait for the next part of our deep dive to find out.
You got it. Stay tuned.
Welcome back to our deep dive into the mystery of breathlessness.
Yes.
With a normal physical exam.
Right.
So we've kind of laid the groundwork here.
Yes.
We've gathered some clues.
Yeah.
And now I think it's time to really explore some of these potential culprits
Okay.
behind our elderly patients' breathing troubles.
That's right. So we've talked about, the importance of that thorough history. And we've done some initial tests.
Yeah.
Now let's actually use that information
Okay.
to delve into those possible diagnoses.
Okay. I'm ready to play detective.
Okay.
What are the top contenders here in this medical whodunit?
Well, one possibility that always deserves consideration, especially in elderly patients, is anemia.
Anemia, really? I mean, isn't anemia about not having enough red blood cells? What does that have to do with the lungs?
It's all about oxygen delivery.
Okay.
Think of your red blood cells like these tiny delivery trucks,
Okay.
carrying oxygen throughout your body.
Hmm.
If you don't have enough of those trucks, your organs and your tissues just won't get the oxygen they need
Right.
to function properly.
So even if the lungs are working fine, the problem lies in the transportation system.
Exactly. And when your body senses that shortage of oxygen, it tries to compensate by making you breathe faster.
Okay, so that's where the breathlessness comes in.
Exactly.
So how do you know if anemia is the culprit in this case?
That's where that full blood count we talked about earlier comes into play.
Yeah.
It tells us the number of red blood cells
Yeah.
in the patient's blood.
Sure.
If it's lower than normal, that points towards anemia.
Okay, so anemia is on our suspect list.
Yeah.
What else are we considering?
Another possibility, particularly relevant in our patient's case because he's overweight,
Right.
is obesity hypoventilation syndrome,
Right.
or OHS for short.
Right. Okay, we touched on this a little bit earlier.
Yeah.
This is the one where excess weight
Yes,
makes it harder to breathe deeply.
that's right. Imagine your chest and abdomen, like this set of bellows.
Okay.
When you breathe in your diaphragm, the muscle that separates your chest from your abdomen
Mm-hmm.
moves down to create space for your lungs to expand.
I'm picturing it.
Now imagine adding extra weight on top of those bellows,
Okay.
right? That weight restricts the diaphragm's movement,
Okay.
making it harder to take those full, deep breaths.
So there's a physical barrier to proper breathing.
Precisely. And over time, this can lead to a chronic shortage of oxygen
Right.
and a buildup of carbon dioxide in the blood, causing that sensation of breathlessness.
So weight is a major clue here.
Yeah.
I mean, would you say that a diagnosis of OHS is pretty much a given if the patient is overweight?
Not necessarily.
Yeah.
While weight is a significant risk factor,
Yeah.
we can't diagnose OHS based on weight alone.
Okay.
That's where those arterial blood gases we discussed earlier come in.
Right.
Remember how they measure the levels of oxygen and carbon dioxide in the blood?
Yes, I remember.
Well, in OHS, we typically see low oxygen levels
Okay.
and high carbon dioxide levels.
Oh, interesting.
Which confirms that diagnosis.
Okay, so those blood tests are really the key
Yes.
to unlocking this piece of the puzzle.
Exactly. Now, let's shift gears a little bit
Okay.
to another possible culprit.
Okay.
Hyperventilation.
Hyperventilation, the one where you're breathing too fast.
Yes.
And end up expelling too much carbon dioxide?
Exactly.
I mean, it seems so counterintuitive that breathing too much could be a problem.
Right.
But I'm starting to understand how it can throw things off balance.
You're right. It's not just about the amount of air you're taking in. It's about the delicate balance of oxygen and carbon dioxide in your body.
Okay.
When you hyperventilate, you exhale too much carbon dioxide, disrupting that balance.
So it causes someone to hyperventilate. Is it always a sign of an underlying medical condition?
Not necessarily.
Okay.
Sometimes it's triggered by anxiety or stress.
Right.
Other times it can be a response to pain or fever
Okay.
or even certain medications.
Oh, wow. So it could be a physiological response to a variety of factors.
Exactly. However, in some cases, hyperventilation can be a symptom
Okay.
of a more serious underlying condition,
Okay.
like a heart or a lung problem.
So it's important to consider all the possibilities.
Exactly. And it seems like blood gas analysis is a recurring theme here.
It does, yeah.
Is that also helpful in diagnosing hyperventilation?
I would think so.
It's essential.
Okay.
With hyperventilation, we see a very distinct pattern:
Okay.
high oxygen levels and low carbon dioxide levels.
Okay.
So it's the opposite of what we see in OHS.
Oh, wow. So those blood gas results are like a fingerprint,
Yeah,
really helping us differentiate between these various conditions.
that's a great analogy. Each condition leaves a unique mark
Wow.
on those blood gas results.
Okay, so we have three very different suspects. Anemia, OHS, and hyperventilation.
Yes,
Each one has its own set of clues,
exactly.
requires specific tests to confirm the diagnosis.
Yes.
It seems like we're getting closer to solving this medical mystery.
We are.
But I can't help but wonder what happens next. How do you actually treat these conditions?
That's a great question, and it's where things get really interesting.
Okay.
Because the treatment for each condition is as diverse as their causes.
Right. It's not a one-size-fits-all approach.
Absolutely not. Let's start with anemia.
Okay.
The treatment really depends entirely on the underlying cause.
Okay.
If it's iron deficiency anemia, which is very common,
Mm-hmm.
iron supplements might be all that's needed.
So that's a simple solution.
Yes, but if it's caused by a chronic disease, like kidney disease, managing that underlying condition becomes the priority.
Okay.
And if the anemia is due to blood loss,
Mhm.
well, then the first step is to identify and stop the bleeding.
So you have to address the root cause
Yes.
to really effectively treat the anemia.
What about OHS? How do you manage that?
Yeah, how do you manage that?
One of the most important strategies for OHS is, you guessed it, weight loss.
Weight loss makes sense. If excess weight is restricting breathing,
Right.
then shedding those extra pounds
Yeah,
should improve lung function.
exactly.
Is it always that straightforward?
Unfortunately, no. While weight loss is crucial,
Yeah.
it's often not enough on its own.
Oh, wait.
Many patients with OHS also require respiratory support.
Respiratory support, what does that involve?
It can range from non-invasive ventilation,
Okay.
where they wear a mask that delivers pressurized air,
Right.
to more invasive interventions,
Okay.
like tracheostomies in severe cases.
Wow. So managing OHS can be quite complex.
It can.
It's not just about losing weight. It's about addressing the breathing difficulties as well.
Exactly. It often requires a team effort
Yeah.
involving pulmonologists, sleep specialists, nutritionists,
Wow.
even psychologists to help patients make those sustainable lifestyle changes.
It truly takes a village to address a complex condition like that. Now, what about hyperventilation? How do you approach that from a treatment perspective?
Again, it depends on the root cause.
Okay.
If it's anxiety-driven,
Mm-hmm.
therapies like cognitive behavioral therapy
Okay.
or relaxation techniques can be extremely helpful.
So in those cases, the focus shifts from like the physical symptoms to addressing the underlying psychological factors.
Precisely. And if hyperventilation is a symptom of an underlying medical condition like a heart or lung problem,
Right.
treating that condition takes priority.
Okay.
And in some cases, medications might be used to manage the immediate symptoms of hyperventilation.
Oh, okay.
But the ultimate goal is to address that root cause.
It seems like there's a common thread running through all of these treatment approaches. It's not just about treating the symptom. It's about understanding the whole patient
Yeah.
and tailoring the treatment plan to their individual needs and circumstances.
You hit the nail on the head.
Yeah.
That's what makes medicine so much more than just science. It's an art.
Right.
It's a human endeavor that requires empathy, compassion, and a genuine desire to help people feel better.
Well said. It's clear that diagnosing and treating breathlessness, even when the physical exam is normal, is a multifaceted challenge.
It is.
We've explored several possibilities, each with its own set of complexities.
Mhm.
But is that the end of the story? Are there any other potential culprits we should be aware of?
You're right, we've only just scratched the surface.
Oh, no.
There are other, less common causes of breathlessness that we
Yeah.
need to explore, and that's exactly what we'll be doing
Okay.
in the final part of our deep dive.
All right, you've piqued my curiosity.
Okay.
I can't wait to uncover those hidden diagnoses.
Okay.
Stay tuned, everyone, for the thrilling conclusion of our breathlessness investigation. All right, everyone, welcome back to the final part of our deep dive
Yes.
into breathlessness with a normal physical exam.
Right.
So we've talked about some really interesting stuff already,
We have.
but as we hinted at, there's still a few more twists and turns left
There are.
in this diagnostic journey.
You're absolutely right. So while anemia
Mm.
Obesity, hypoventilation syndrome, and hyperventilation are all important to consider.
Yeah.
They don't actually represent the entire spectrum
Right.
of possibilities.
Okay.
Sometimes breathlessness can actually be a sign of something even less common,
Okay.
something that might not immediately come to mind.
Okay, now you've really got me intrigued. What kind of less obvious conditions are we talking about here?
Well, one possibility that we should always have on our radar, especially in an elderly patient like ours,
Mm.
is heart failure.
Heart failure. Wait, but wouldn't we see some abnormalities
Oh,
in the physical exam or the initial tests if that were the case? I
yeah.
mean, his exam was totally normal.
Not necessarily. Heart failure can be pretty subtle
Okay.
in its early stages, and its symptoms can mimic other conditions.
Okay.
Remember, a patient's physical exam was normal,
Right.
which means we have to be extra vigilant and consider all those possibilities.
So how could heart failure cause breathlessness without any of those obvious outward signs?
It all comes down to the heart's ability to pump blood effectively.
Okay.
In heart failure, the heart muscle weakens,
Mm-hmm.
and it just can't keep up with the body's demands.
Okay.
This can lead to a buildup of fluid in the lungs,
Okay.
which is called pulmonary edema.
Pulmonary edema.
Yeah.
So even though the problem starts in the heart, it's that fluid buildup in the lungs that
Yes.
makes breathing difficult.
Exactly. And this is where those more specialized tests we talked about earlier,
Right.
like an echocardiogram,
Yeah.
which uses sound waves to create images of the heart,
Okay.
or even a cardiac catheterization,
Mm-hmm.
which involves threading a thin tube into the heart.
Okay.
To really assess its function,
Hmm.
become crucial in confirming the diagnosis.
So it's like we need to zoom in and take a closer look
Yes.
at the heart to see if it's really the mastermind
Exactly.
behind the breathlessness.
Now another less common, but potentially serious cause of breathlessness
Yeah.
is pulmonary hypertension.
Pulmonary hypertension that rings a bell, isn't that high blood pressure in the arteries of the lungs?
That's right. And it can make it much harder for the heart to pump blood
Okay.
through the lungs,
Right.
leading to shortness of breath fatigue and even chest pain.
So like the heart's working overtime,
Yeah.
struggling to push blood through those constricted arteries.
That's a great way to visualize it.
Yeah.
And just like heart failure, pulmonary hypertension can be tricky to diagnose in its early stages,
Okay.
especially when the physical exam doesn't reveal any red flags.
So what are some of the clues that might raise your suspicion for pulmonary hypertension?
Well, certain risk factors can increase our suspicion,
Okay.
such as, a history of blood clots in the lungs,
Okay.
connective tissue disorders, or even the use of certain medications.
Mm-hmm.
And sometimes a subtle heart murmur that we might pick up during the exam can be an early sign.
So once again, it's about really carefully piecing together
It is.
all the puzzle pieces, the patient's history, risk factors, symptoms, and any of those subtle findings
Yeah,
during the exam.
absolutely. And if pulmonary hypertension is suspected, we would likely order a right heart catheterization,
Right.
which is a specialized test that measures the pressure in the pulmonary arteries.
Okay, so we've added heart failure and pulmonary hypertension to our list of suspects.
We have.
Are there any other diagnoses lurking in the shadows that we need to be aware of?
There's actually a whole category of conditions called interstitial lung diseases
Okay.
we should consider.
Interstitial lung diseases, those sound pretty serious.
Yeah.
What exactly are they?
They're a group of disorders that affect the interstitium,
Okay.
which is the tissue that surrounds those tiny air sacs in the lungs,
Okay.
called alveoli.
So not the air sacs themselves, but the tissue surrounding them.
Precisely. And when this tissue becomes inflamed or scarred,
Okay.
it can stiffen the lungs and interfere with their ability to expand and contract properly, making it difficult to breathe.
So even though the airways themselves might be clear,
Right?
the lungs can't function efficiently
Right.
because of this damage to the surrounding tissue.
Exactly.
It's like trying to inflate a balloon that's lost its elasticity.
That's a fantastic analogy, and interstitial lung diseases can be caused by a variety of factors,
Yeah.
including autoimmune disorders,
Okay.
exposure to certain environmental pollutants like asbestos, and
Right.
even some medications.
It sounds like another complex category of conditions that requires a really thorough investigation to pinpoint that underlying cause.
You're absolutely right. The diagnosis often involves a combination of things.
Okay.
Things like high-resolution CT scans to visualize the lung tissue, pulmonary function tests to assess, lung capacity and function,
Okay.
and sometimes even a lung biopsy to examine the tissue under a microscope.
Wow. This deep dive has been a real eye-opener.
Yeah.
I had no idea there were so many potential explanations for breathlessness.
I know, it's fascinating.
Even when the physical exam is normal, it seems like the human body is just full of surprises.
It certainly is, and it's really a testament to the complexity of the human body and the importance of, taking a systematic and thorough approach to diagnosis.
Absolutely. So we started this journey with what seemed like a pretty straightforward case, right?
Right.
An elderly man experiencing breathlessness.
Yeah.
But as we've delved deeper, we've encountered such a fascinating array of possibilities.
We have.
From common culprits like anemia to more obscure conditions like these interstitial lung diseases.
It's true, and throughout our exploration, we've highlighted the crucial role of careful history-taking,
Right.
targeted investigations, and open communication with the patient.
Yeah.
Remember, a normal physical exam doesn't mean there's nothing wrong.
Right.
It just means we need to be even more diligent in our investigation,
Yeah.
considering all the angles and possibilities.
It's a powerful reminder that every symptom,
Yeah.
no matter how seemingly simple, has a story to tell.
It-
And it's up to us, the medical detectives, to listen carefully,
Yes.
gather our clues, and piece together that puzzle
Exactly.
to uncover the root cause.
For anyone listening out there who might be facing a medical mystery of their own, just remember there's always an answer.
Yeah.
It might take time, persistence, collaboration with your healthcare team, but don't give up.
That's right. Keep asking questions.
Yes.
Keep advocating for yourself and trust that your body is trying to tell you something important.
It is.
Listen to it
Yeah.
and work with your doctor to find the answers you need.
That's a perfect message to end on. Remember, knowledge is power.
It is.
Understanding your body is that first step towards taking control of your health.
Well, thank you so much for joining us on this incredible deep dive
Yes, thank you.
into the world of breathlessness. We hope you learned something new
Yes.
and that you feel empowered to be an active participant in your own healthcare journey.
Absolutely.
Until next time, stay curious, stay informed, and stay well.